gentlemen, the books is in. The books are in. Yep. They're in. They're here. ETM Hotel, Rennie Shawn. Welcome in peace. My name is Shawn. I'd like to thank everybody for tuning in to Kofi Pie Side TV. Man. We are on Facebook and YouTube. Please like the show, share the show, tell a friend, tell a friend. We are actually going to deal with does the mRNA vaccine, the messenger RNA vaccine cause or not cause, but does it alter your DNA? This is a lingering question from our last conversation, and we're going to tackle it here today during this build. I am on my Facebook page. I am also on Kofi's Facebook page. I took over Kofi's Facebook page, and we are also on KofiPodsideTV.com on YouTube. Again, man, if y'all are tuned into the show, you know what I'm saying, like the show, like the show, share the show, tell a friend. We in the building, you know what I'm saying. Let's get it going. Please share this joker. Yep. See, we got a few people in the building. Before we get started, though, T'Challa, you got something you want to say?
No, I'm ready for you to deal with this.
I understand that. I'm kind of waiting on the person to ask the question to actually appear. You feel me? What up, great Nate? Aquaphonics himself. What's good, brother Nate? What's good, Vasa? Yeah, I'm trying to see if the person who asked the question is going to appear so that we either can get them on board, or we can get the people that's sending them the info on board so we can deal with it. And see what's going on with that. You know what I'm saying? Again, like the show, share the show. Let's get it cracking, ladies and gentlemen. Where you at? So Keisha posed the question on our last bill. She said, can it alter? And instead of going back and looking at the other videos that we have, you know, we just gonna make it plain about this one. So I see we do have some people in the building. Again, man, like this, share this, please. Let's go. I know we got people on YouTube, in the YouTube world. Garfield says my DNA is 666. You hear? Yeah. So Brother Garfield is tuned in. The number one troll is in the building. As always, that's the number one troll. You know what I'm saying? Kicking up dust. But yeah, man, I can't believe we got great Nate in the building, yo. It's a pleasure, bro. It's a pleasure. So let's go ahead and let's deal with the claim. Does the mRNA vaccine alter your DNA? All right. Oh, I was just told here the person comes. So let me just give me like I'm gonna give her like 30 seconds anyway, and then we'll get into that. So all right, let me check Facebook. So I can't see all the comments, but I can see some of the comments. So I want to see. I want to go ahead and share this to people. Let's go to groups. And let's get this in all the groups. You know what I'm saying? Because, this how this stuff spread. We want to spread the truth like we spread the lie. You know what I'm saying? We want it to go viral too. So we want to spread the truth like the lie. Yeah. Let's deal with it. We ain't going to be all day with it either. We're going to keep it short and sweet, and then we're going to continue on with our conversation. But the first thing we want to tackle, okay, all right. All right, I see that the question there is in the building. Let's not hold nobody up, and let's get directly to the business. So whoever sent you whoever asked you that question or shared any video pertaining to does it alter your DNA, you can go ahead and you can share this video with them, and we're going to get it in. So I'm going to share my screen. I'm going to thank everybody for tuning in, and we're going to tackle this immediately. Now, I'm not going to use the CDC first. All right, I'm gonna go directly here. I'm gonna go to Nebraska Medicine. It says you ask, we answer. Can mRNA vaccines alter human DNA? This was published. Look, December the 21st, 2020. This is a recent publication. Now, here's the question. Do mRNA vaccines work by altering human DNA? The answer from infectious disease expert James Lawley, MD, MPH, and we're going to add on to it. No, the vaccine cannot change your DNA. The two COVID-19 vaccines approved by emergency use authorization by the US FDA use mRNA or messenger RNA to instruct your body to build a coronavirus spike protein. Your body then produces antibodies to combat the coronavirus when it encounters it later. And now we can learn about how antibodies work, but first we're going to continue to deal with it. So the mRNA vaccine is very fragile and it's very quickly degraded once inside your body. That's one of the reasons why these vaccines must be so carefully preserved at very low temperatures and why you need 2 doses. Additionally, DNA is stored in the nucleus of your cells. mRNA vaccines are designed to do their work outside of the nucleus and have not been observed to interact with the nucleus. All right, so let's get the latest updated information and let's go see what antibodies are. Nah, we ain't gonna deal with antibody. Let's see how the mRNA works. All right. Now, this was published on the 17th. Okay. So here, I know people don't really know what we're looking at, but when you're dealing with cell membranes and things of that nature, you'll get into everything. So you see this outer shell right here. Look at your arm, pretty much. We did a class on this on the Monster Warrior Clan where I said I asked people to name all your defensive mechanisms against a pathogen, right? Your skin is one. All the skin all over your body, that's one, right? Another one would be the tears in your eyes. Another one would be your nostrils, the hand, your nose, and all that. Mucus is also another defense mechanism, right? These are things that we've already talked about and that we've already educated everybody on, right? Okay. Yep. See, people on YouTube are answering. Now, you got your cytoplasm, you got your nucleus here, you see, you got your nucleolus here. All right. You got your rough endoplasmic rectum right here, right? You got all these things, the ribosomes right here, these little dots on, right? Citrosomes right here. All right, cool. That's a lot over people's head. Now, the COVID-19 vaccines by Pfizer and Moderna are both mRNA vaccines. These innovative vaccines place a small set of short-lived instructions inside your cells. Previous vaccines use either weakened or inactivated viruses or parts of them to jumpstart the immune system. Okay, let me let this person in. All right, they in. All right, now, okay. Now, I'm going to go off the dome real quick, and then I'm going to come back to this. The mRNA vaccine, this is how it works. So we all know that there's the COVID-19 operates, by infecting the human body using a spike protein. The messenger RNA vaccine teaches the body how to recognize the spike protein of COVID-19 by when it's injected into the body, it creates a defense mechanism throughout the body, teaching it how to make spike proteins to reject or refute the entrance of an outside spike protein, SARS-CoV-2, COVID-19. All right, so we're dealing with COVID-19. Now you have basically created off, and it rejects it. The claim is, does it causes it to alter your DNA? That was the question that is asked. There are people that also make the claim that it does do that, and we've dealt with it substantially, but I'm kind of going off the cusp to show y'all how the vaccine actually works. Okay, so let's see if this bullet point kind of bags up what I just said. Now, it's going to be more technical, and I basically told you when it enters your system, it teaches your cells how to create the spike. It teaches your body how to build a spike protein, which basically, in layman's term, build an immune response against the spike protein trying to enter your body. All right, so here we go. The mRNA vaccine goes into your arm. This mRNA instructs your own cells on how to build a part of the protein that the virus has, i.e. the spike protein. The needle will hurt like when receiving other vaccines. Your muscle cells take up this mRNA and read the instructions, building the spike protein that are also on the coronavirus. Now, some of the spike protein shows in part or in whole the surface of these cells. Your immune system recognizes that the protein is different. It starts to reproduce the antibodies as well as train your immune cells to recognize it in the future. When your body next sees SARS-CoV-2, some antibodies will be there to start protecting immediately, and immune cells will be primed to increase the protection. You need both injections of the mRNA vaccine to get the full protective effects. One shot alone does not protect the way that was seen in the clinical trials. The mRNA is quickly degraded inside of your body, so it doesn't stick around. If it doesn't stick around, it cannot alter DNA, and it's housed in the particular cell where it doesn't even go beyond that because the DNA is further down the line. Now, it asked again, does COVID-19 mRNA vaccine give COVID-19? No, the COVID-19 mRNA prevents COVID-19 disease. Since mRNA vaccines don't carry any virus, the vaccine cannot cause COVID-19 infection. That's big. It does not carry the virus. Now, do mRNA vaccines change your DNA? Again, no. COVID-19 mRNA vaccines do their work outside the nucleus in the cytoplasm. DNA is in the nucleus. So if we go back here, we see the nucleus is here. It does its work outside of the nucleus. Outside of the nucleus. It doesn't go in, it doesn't pinch it or none of that. It does its work outside. All right. So let's go back here and let's see how antibodies work. All right. Now, this is April 22 by Jasmine Marcelin, MD. This sister here. Appreciate your sister putting your work in out there in the field. Now, to track the spread of the coronavirus, researchers are developing antibody tests using the samples. The COVID-19 antibody test is one way to identify people who have been exposed to the virus, even if they don't show any symptoms. That's why when they do those tests, initially they were going in your nose, right? All right, while COVID-19 antibody tests are currently in development, scientists have used antibody tests for other illnesses for years. Find out how antibodies could potentially be used to protect, prevent, or even treat COVID-19. Blood tests detect coronavirus antibodies. Antibody tests, also called serological tests, detect antibodies in a person's blood. Your body produces antibodies to defend against bacteria. That's the whole premise of the antibody. The viruses and anything else in your immune system recognizes as foreign. In a COVID-19 antibody test, researchers determined if it collected blood samples as antibodies, which are targeted to coronavirus. If antibody test becomes acceptable, Tracking the coronavirus and slowing its spread will become easier. Antibody tests can slow the spread of COVID-19 by identifying how prevalent the infection actually is in the community, speeding up testing in areas where nasal swab testing, PCR based, is not available, provide passive immunity by transferring coronavirus specific antibodies, creating the ability to develop candidates for a vaccine. All right, so this was back in April. We are already at the point of where we have two working mRNA vaccines that have high efficacy rates, both over 90%. All right, I'm not gonna read this whole thing to you. You actually can follow the path on what I said, and remember, all my sources is in the chat. Okay, now let me give you a quick video on. Let me give you a quick video on this.
Check out this amazing illustration of the COVID vaccine. In an actual COVID infection, the virus enters the cell through its spike protein. This is how infections happen. Now, the vaccine is mRNA, which are the instructions to build the spike protein, inside a lipid layer that enters the cell and releases the mRNA. Ribosomes inside the cell attach to the mRNA and start building the spike protein. The spike protein itself is not harmful. Those spike proteins leave the cells and start circulating. Our immune system thinks this is a COVID infection and recognizes the spike protein and starts creating antibodies against the spike protein. If you are then exposed to the actual virus, our immune system remembers those spike proteins and antibodies attached to the virus, making it impossible to enter our cells and create an infection. Isn't science amazing?
All right, quick little video. Now, let me give you a little bit more science behind that. But first, I want to deal with CDC explanation. We had a CDC as an explanation. I've done this numerous times. If I am going too fast, don't worry. I got the source in here. You can follow up and you can fact check, or you can ask more questions. So, understanding and explaining mRNA COVID-19 vaccines. The messenger RNA vaccine, also called mRNA vaccine, are some of the first COVID-19 vaccine authorized for use in the United States. This page provides vaccine information for healthcare professionals and vaccine providers and tips for explaining mRNA vaccines to patients and answering questions about how mRNA vaccines work, their safety profile, and common misconceptions. All right. So there's some key points here that we could tackle and deal with. Like all vaccines, COVID-19 mRNA vaccines have been rigorously tested for safety before being authorized for use in the United States. mRNA technology is new, but not unknown. They have been studied for more than a decade. mRNA vaccines do not contain a live virus and do not carry a risk of causing disease in vaccinated persons. mRNA from the vaccine never enters the nucleus of the cell and does not affect or interact with a person's DNA. All right, this new approach. The mRNA vaccine take advantage of the process that cells use to make proteins in order to trigger an immune response and build immunity to SARS-CoV-2, the virus that causes COVID-19. In contrast, most vaccines use weakened or inactivated versions of components of the disease, causing pathogens to stimulate the body's immune response to create antibodies. That's why, like, when you get something injected into you, you always are going to have some type of reaction to it, right? Because you're immune, you have triggered an immune response, and your immune response is giving you that little weakened phase or whatever you may be going through to deal with that. All right, now I'm not going to harbor on this too much longer, but I do, like I said, have the evidence with a source in the description. All right, so now let's deal with some fact checking regarding potential conspiracies of mRNA vaccines. All right, they say it's fact check. Gates was not caught on video saying the COVID-19 vaccine will change your DNA forever. Now, this is what spawned this whole thing, right? So let's deal with it, because we got people that want to blame Gates for a lot of things. Now, viewed tens of thousands of times a video claiming Bill Gates got caught admitting vaccines will change your DNA forever. The video features authentic footage of Gates, but misrepresents his remarks. He was explaining how vaccines developed with messenger RNA, mRNA technology work. The claim that an mRNA vaccine will modify a person's DNA is also false. All right. This video was visible on YouTube, BitChute, here and another place. So let's take a look at the actual video and let's see if we can get it. Now, the video features a segment of footage visible on Gates' own YouTube channel here and a blog. And in a 2-minute and 29-second video, Gates explained how vaccines work and are different. All right. So what we want to do. Okay, it's an error. All right, so let's deal with it. Let's see if it'll play for us.
The most urgent invention in the world right now is a vaccine that prevents you from getting COVID-19. What vaccines do is they teach your immune system about the pathogen. This is the coronavirus, and this shape on its outside is called the spike protein. It grabs on to the cells in your body that have a particular receptor and get that cell to make billions of copies of this virus. The first time that you're exposed to this virus, it takes literally days for your immune system to realize that it's a bad thing. So how do we get the immune system to go faster? Well, the idea of a vaccine is to give you an exposure to something that looks like this. So you're getting your body to make a lot of antibodies that can take these viruses and actually kill them. There's over 100 different efforts making many different types of coronavirus vaccines. So how do you make a vaccine? Usually you're injecting at least part of the shape of the virus. Sometimes you do the whole virus, but it's attenuated so it doesn't multiply too much. Sometimes you take the virus and you kill it. You won't get sick because they're not duplicating. What's typically done is you just take either a piece of the virus or just the spike, that thing on the surface, and you put it on something else. So there's no risk at all of causing the disease. One final way that's new and is promising is called the RNA vaccine. With RNA and DNA, instead of putting that shape in, you put instructions in the code to make that shape. So the Gates Foundation, along with a great number of partners, are looking at these different efforts. We've never created a new vaccine in less than 5 years. So this is urgent, and it's going to require incredible collaboration. It's going to have to go to 7 billion people. So I am optimistic that one of the vaccine efforts will give us vaccines in the next 18 months. And we'll make sure that it's produced in volume and that it's accessible to everyone in the world. That's how we're going to end this pandemic.
All right, so a spokesperson for the Bill and Melinda Gates Foundation confirmed to Reuters via email that the original video shows Bill Gates discussing COVID-19 vaccines. They confirmed mRNA vaccines do not change a person's DNA. Bill Gates did not make such a claim. The clip in question shows Gates explaining how vaccines develop with the mRNA technology. Full footage provides an additional context to his remarks, as he said. Let's see if we can open this up and let's get his context, and then we can come back to that.
One final way that's new and is promising is called the RNA vaccine. With RNA and DNA, instead of putting that shape in, you put instructions in the code to make that shape. So the Gates Foundation, along with a great number of partners, are looking at these different efforts. We've never created a new vaccine in less than 5 years. So this is urgent, and it's going to require incredible collaboration. It's going to have to go to 7 billion people. So I am optimistic that one of the vaccine efforts will give us vaccines in the next 18 months.
All right, so that just proof positive that we listen to the correct video. Now, what's typically done is you take either a piece of the virus or just the spike, that thing on the surface, and you put it on something else. So there's no risk at all of causing the disease. One final way that's new and is promising is called the RNA vaccine. With RNA and DNA, instead of putting that shape in, you put instructions in the code to make that shape. The video in this claim then repeats the sentence. You put the instructions in the code to make that shape. Gates is saying that RNA vaccines put instructions in the code that make that shape, referring to the genetic code needed to produce a pathogen's antigen, as explained in his blog on on the subject here, which is used by the immune system to fight the disease. All right, which he explained. Now, RNA vaccines, as explained by the CDC, the mRNA in the COVID-19 vaccine is not able to alter or modify a person's genetic makeup, DNA, and it does not affect or interact with DNA in any way. Now, Reuters previously debunked similar claims on social media. All right, so I'm not going to get into the rest of the things that have been transcended over. This link is also in the description, and we heard it out of the horse's mouth, and then we broke down his claim. On to the next. All right, so let's talk about SARS-CoV. We'll get back to this in just a second. Let's deal with this right here. Now, this is an entire article, and in this article, the most important part is the video part. That's why I was down there. But this is the journey of no, really, mRNA vaccines are not going to affect your DNA, right? This was published on November the 24th, and here you have an image of basically the cell membrane going on, everything that we talked about earlier, dealing with the nucleus. You see all of that. You know, you see where your DNA over there hiding at, right? You seeing where these proteins and all those things are going. Yeah, so this is similar to what we've already been talking about. Now, I did leave this in the link because if I read this and I read it very slowly, you're not going to catch some of these technical terms. So what I'm going to do is give you the meat and the potatoes in summary. All right, watch this. I gotta kill the music. Facebook will give me. And this video was just a minute long. God. It might be music all the way through. Yeah, so watch. Because it's gonna be music all the way through, and it's basically it's telling you what's going on. I'm gonna start it over again if you don't catch it. All right, it's saying it at the top. If you're worried about the mRNA vaccines, then don't get them. The data suggests that there will soon be other kinds of vaccines with good efficacy as well. I, however, am content to roll up my sleeves for one of them. Now, he's telling you how. Look, let me go back. The first strand of DNA will displace. Strand displacement, go there. He's doing everything that he need to do in this article to tell you how this thing is working. Now, when this was actually published, dang it, my bad. When this was actually published, it was in reference to some other things that transpired. mRNAs are the actual lead. You don't believe me? Let's go forward.
SARS-CoV-2 vaccines that are being made. There's 62 as of last night. I counted them all. We have attenuated vaccines. These are being made by making deletions like the one I just showed you, or by de-optimizing codon use. It turns out that you can change the codons, have the same amino acids, and make attenuated viruses that way. There are formalin inactivated vaccines, subunit, 20 different subunit vaccines by producing glycoproteins in insect or plant cells, making virus-like particles. There are vectored vaccines, 5 of them with adenovirus vectors, and others using flu, vaccinia, measles, or horsepox as vectors to deliver the spike glycoprotein gene. And finally, nucleic acid vaccines. There are 12 mRNA vaccines. And here what they do is they have the mRNA for the spike of SARS-CoV-2. They encapsulate it in in these lipid nanoparticles. They're injected. And I think on the next slide, we'll see how they work. And DNA vaccines are also being tested. Instead of the RNA, you inject the DNA into the arm. So the mRNA vaccine works. This is injected into you, can be taken up by antigen presenting cells, for example, here at the lower right. So this RNA could get into an antigen presenting cell. It could then be processed and displayed and presented to T cells, just like a normal viral antigen would be. It could get also into non-antigen presenting cells, various cells in the body where it's injected. The mRNA would be translated into protein that could be processed and displayed. These cells could also release the protein, and the protein could be picked up by antigen presenting cells. These vaccines have been shown to work in experimental animals for different viruses. This is now in a phase 1 in humans. It was the first SARS-CoV-2 vaccine to go into a phase 1 in humans. And I haven't heard anything bad so far. So presumably that will go into a phase 2 shortly, and we can see if it's protective. These can be made very quickly. These were made initially in January. As soon as the sequence was made, tested in animals, and got ready for phase 1. So that's quite remarkable. We'll talk more about vectors later in the course, but you can use viruses to carry genes for vaccines, and vesicular stomatitis virus has been developed as a popular.
Now, this whole thing is about SARS-CoV-2, so I'm not going to get into the rest of the actual bill. I'm going to let him complete out the end of the actual video, but he basically said the reason why it was made fast because technology allowed them to be able to do these things, which would then put forth. So it does not alter or affect your DNA in any way, right? We have the clinical studies from Pfizer and Moderna, and soon we will have AstraZeneca's results, and we can weigh the data, right? These fake videos that are circulating on Facebook and other social media platforms that are getting banned do not tell the truth. Similar to the lady whose name is supposed to be Kalia, Mitchell, right? She says she's a nurse, and then we looked up, we went to the website, right? We clicked on the nursings, right? We tried to find evidence of this lady being a nurse in the state of Tennessee, because all nurses practicing or no longer practicing are listed on a PDF document that has every nurse in the state of Tennessee. And when you look on that list, her name was not there. People in the chat looked up her Facebook page, did not uncover a Facebook page. So we don't know who this sister is, but yet there's a video going around of this black lady who claims to have Bell's palsy, which is, pretty much she's trying to relate it to the actual vaccine. And we don't even know where she took the vaccine, what hospital she took the vaccine at, and if she's even a nurse. I can tell you right now, it's not looking too good. The video occurred from a anti-vaccine website. It's pretty much propagated. And, my brother Satepara said something smart. He said, Shawn, if that was the case, why would she make a YouTube video and not sell her story to a news media outlet where she would have got money for it? So why give away a free story when you can make thousands of dollars off your story, and the news would have been willing to give you that because it would have gave you that airtime, and on top of that airtime, you know what I'm saying, that news media outlet would have got it spin and spin and spin and spin around the world. However, let this guy finish out, and then I'm gonna end the Facebook.
Vaccine vector. This is a virus with a negative strand RNA genome. It makes envelope particles with a glycoprotein. you can replace the glycoprotein gene with whatever gene you want. In this case, SARS-CoV-2 glycoprotein has been inserted into VSV. The way you do that is you have 4 plasmids encoding the NP and L viral proteins that constitute the RNA polymerase. You have another plasmid with the RNA genome with the transgene in it. You put these in cells. They're driven by the T7 promoter, so you also infect with a vaccinia virus that makes T7 RNA polymerase, and these replicate, produce infectious particles. So you will make VSV with the spike of SARS-CoV-2, and eventually they'll go into phase 1 and phase 2, hopefully. There is one vaccine based on this technology that's been licensed. It's Ervebo anti-Ebola virus vaccine, which is licensed in many countries, including the US. Was originally developed many years ago by the military because they wanted to protect troops who were going to countries where there might be Ebola outbreaks. And it went through a number of phase 1 trials, but never proceeded to phase 2 until the big 2015 outbreak of Ebola virus disease in West Africa. And then they were subsequently tested last year in DRC, and then licensed. So you can bring vaccine development to a certain point, even if you don't have a lot of disease, and get ready in case there is an outbreak. And I think that's going to be a model for future vaccines, to have them brought to the point, even if there is no big outbreak, you can bring them to a point where they can be tested rapidly if there is an outbreak. Unfortunately, we're not in that situation now. We're having to catch up, but we could have been ready. All right, so those are
All right, so I want to go back real quick to what he showed here. The most important part of all of this conversation that he talked about that may have lost many of you, it's your first time even being familiar with this, is this part, replacing the G gene with transgene. Here is where you can modify the molecule, pretty much, is what he said. You can modify the messenger. You can deal with, hey, boom, I need you to cooperate like this, and then it'll go through the rest of the phases as normal, and then it can create the spike protein to defend itself against a new virus. All right, so again, it does not alter your DNA. Does not alter your DNA. And on that note, we're going to after show it on Kofi Pieside TV. And we're going to continue to build in the conversation. Like I said, if you're on Facebook, man, we on Kofi Pieside TV YouTube channel. We're ending the Facebook right now. Y'all can share that if y'all want to. Get the message out. Does not alter your DNA. And demonstration beats conversation. Yep. And let me end it on Kofi's. And now we just live on YouTube. Again, like the show, share the show. We kept it bite-sized. We hit it in 38 minutes. We dealt with the actual claim. You know what I'm saying? I want to go back and play. Let me get Vince. I want to replay what Vince was saying right here because it's critical. And then I want to make sure that y'all kind of catch what he's saying about how this mRNA vaccine worked, because he did that a long time ago. And then he gave you a jewel. He said, well, look, there's already an mRNA vaccine out right now that the military is using. Did y'all hear that?
challenge. So once this goes through trials, I think this will be a license that'll probably replace Dengvaxia, but it's an example of using recombinant DNA approaches to make new vaccines. Here are all the different SARS-CoV-2 vaccines that are being made. There's 62 as of last night. I counted them all. We have attenuated vaccines. These are being made by making deletions like the one I just showed you, or by de-optimizing codon use. It turns out that you can change the codons, have the same amino acids, and make attenuated viruses that way. There are formalin inactivated vaccines, subunit, 20 different subunit vaccines by producing glycoproteins in insect or plant cells, making virus-like particles. There are vectored vaccines, 5 of them with adenovirus vectors. and others using flu, vaccinia, measles, or horsepox as vectors to deliver the spike glycoprotein gene. And finally, nucleic acid vaccines. There are 12 mRNA vaccines. And here, what they do is they have the mRNA for the spike of SARS-CoV-2. They encapsulate it in in these lipid nanoparticles. They're injected. And I think on the next slide, we'll see how they work. And DNA vaccines are also being tested. Instead of the RNA, you inject the DNA into the arm. So the mRNA vaccine works. This is injected into you, can be taken up by antigen presenting cells, for example, here at the lower right. So this RNA could get into an antigen presenting cell. It could then be processed and displayed and presented to T cells, just like a normal viral antigen would be. It could get also into non-antigen presenting cells, various cells in the body where it's injected. The mRNA would be translated into protein that could be processed and displayed. These cells could also release the protein, and the protein could be picked up by antigen presenting cells. These vaccines have been shown to work in experimental animals for different viruses. This is now in a phase 1 in humans. It was the first SARS-CoV-2 vaccine to go into a phase 1 in humans. And I haven't heard anything bad so far, so presumably that will go into a phase 2 shortly, and we can see if it's protective. These can be made very quickly. These were made initially in January. As soon as the sequence was made, tested in animals, and got ready for phase 1. So that's quite remarkable. We'll talk more about vectors later in the course, but you can use viruses to carry genes for vaccines, and vesicular stomatitis virus has been developed as a popular vaccine vector. This is a virus with a negative strand RNA genome. It makes envelope particles with a glycoprotein. You can replace the glycoprotein gene with whatever gene you want. In this case, SARS-CoV-2 glycoprotein has been inserted into VSV. The way you do that is you have 4 plasmids encoding the NP and L viral proteins that constitute the RNA polymerase. You have another plasmid with the RNA genome with a transgene in it. You put these in cells. They're driven by the T7 promoter, so you also infect with a vaccinia virus that makes T7 RNA polymerase. And these replicate, produce infectious particles. So you will make VSV with the spike of SARS-CoV-2, and eventually they'll go into phase 1 and phase 2, hopefully. There is one vaccine based on this technology that's been licensed. It's Ervebo anti-Ebola vaccine, which is licensed in many countries, including the US. It was originally developed many years ago by the military because they wanted to protect troops who were going to countries where there might be Ebola outbreaks. And it went through a number of phase 1 trials, but never proceeded to phase 2 until the big 2015 outbreak of Ebola virus disease in West Africa. And then they were subsequently tested last year in DRC, and then licensed. So you can bring vaccine development to a certain point, even if you don't have a lot of disease, and get ready in case there is an outbreak. And I think that's going to be a model for future vaccines, to have them brought to the point, even if there is no big outbreak, you can bring them to a point where they can be tested rapidly if there is an outbreak. Unfortunately, we're not in that situation now. We're having to catch up, but we could have been ready. All right.
So I put that information in the chat on y'all. So there you go. You got the first mRNA vaccine that was used by the military. That might be news to a lot of ears. The first mRNA vaccine used by the military. There you go. All right, so on Facebook, I had a brother telling me that I'm spreading misinformation. I actually told him to come on. I tagged him. He said, please stop with the misinformation. I said, actually, you're misinformed. He says, have a fabulous time. I'm not going to waste my time debating you. It's not a debate. It's not a debate, brother. I told him, you type, I teach. But he says, it doesn't reach the nucleus. Shut up if you're not a specialist. So he believes that it reaches the nucleus. He believes that it alters the DNA. That's what he believes. You know what I told him? Demonstration beat conversation. If I'm wrong about something, come and correct me. I sent him the link. He is free to join. He is free to join. All right, so now we know the first mRNA vaccine been around. It was used by the military. It was used to fight Ebola, and we got what it is. It's in the chat. Have y'all heard anybody from the military complaining about this shot? Have y'all heard? Y'all quiet, man. What's going on, man? What's going on, man? Y'all didn't even share the show. Nah, he ain't joining law. He said, and I'll tell you what he said. He said he don't want to engage in no debate with me or something. It's not no debate. We ain't debating. I have a fabulous time. I'm not going to waste my time debating you on something you don't really understand. So here's my question to anybody who says things like that to me. If I really don't understand, then brother, won't you come make me or help me understand? Because saying I don't understand something, and then, that seems like to me that you're withholding information against our people who are currently under attack against COVID-19. We're suffering the most from COVID-19, and you telling me that I don't understand. What do I not understand? I got all the scientific data. I lead myself to credible scientific resources. I'm listening to credible scientists in the field, but yet you're telling me that I don't understand. So what are we doing here? Yeah, Law, that's all they're gonna do is keep on, bro. He done been in my inbox before. I didn't respond to him in my inbox. He in the, the inbox where in your spam box. Y'all think I'm playing? Watch this. I don't know. I can show y'all he in my spam box. Y'all see that? You see how I say delete or block? He in my spam box. I had responded to him, and then I said, man, I ain't responding no more. He in my spam. He hit me up December 10th. I haven't said anything else since then. He was talking about Tuskegee and all this other stuff. He didn't also put on other posts some stupid, idiotic things. And brother, if I'm misinformed, educate me. Don't play on my ignorance. You know what I'm saying? Don't play with me like that. Don't play on my ignorance, yo. I told y'all that I snapped. All right, so let's see what we going on. Christian, Muslim, Rastaman. Okay, what up? Mboka, what up? John Mboka. Questions, comments, concerns. Everybody cool? We got it? No, this nigga, he on Facebook, whoever you. T'Challa, Sutik, y'all got anything, man? regarding the video, anything that you need further understanding or comprehension of?
No, I'm
Nah,
good.
nah, good work, bro. That's all I gotta say. I'm learning as I go.
Man, we all learning, bro. We all learning. But how y'all feel about the mRNA vaccine already in use by the military? Yet y'all had no idea that the military had an mRNA vaccine in the works that was already circulating among the military who were going in places heavily affected with Ebola.
I mean, I understood that already. It's plenty of things that the military have to be hip to and have to be able to encounter and deal with because they're the ones, like you just said, if you in a heavily infected area, what good is your military if they all die and they interact with the virus?
Yeah, West Africa, it never enters the nucleus. Never enters the nucleus. It doesn't go that far. And that's why it has to be kept at cold temperatures. And they keep telling us that because it has to go to a certain point. It has to get to a certain point and then it disintegrates. So if it gets to a certain point and then it disintegrates, what good is it at that point? Because your body, the inside of your body goes to a certain temperature so fast when it encounters that particular temperature, it gets rid of it. This thing is dissolving almost. This is why y'all remember when I was talking about like in the earlier videos I was with Science with Shawn, I was talking about how the problem they're trying to get, talking about getting home, that last mile. The scientist was talking about the last mile. The last mile consisted of from the time it left the warehouses to the time it got to the factories to the time it got into a person's arm. That last mile was the problem for them because they wanted it. They knew that it had to be kept extremely cold. And because it had to be kept extremely cold, that they didn't want it to wear off on you before it got to its destination. Therefore, you know what I'm saying? Man, listen, bro. I'm not responding to you. I ain't selling my house. All right. So that last mile was critical because you couldn't time it up right, or they couldn't time it up right. They didn't want any delays, any hesitations, any loss of temperature. So now they have got the logistics right, using the military to get the logistics right. They're able to get the shot to your arm. Now, from the time it gets from where it's going into to your arm, right? That's that temperature, that warm temperature coming into play. So inside your body just going. Appreciate that, Wes. Right, Law. But the military already got one mRNA vaccine, which was to fight Ebola. And the military now is being, you know what I'm saying, they getting their vaccines dealt with on that level too. So, because they got to be out there in the population. They got to be they got to be all over the world. By the way, old girl, that nurse, she ain't showed up on CNN yet. She ain't showed up on MSNBC. And we ain't seen it on Fox. And Fox should have been the first one doing something. We ain't seen it. Now, people can say, oh, they censoring it. No, they ain't censoring it. There's nothing to censor. Kisu, that would be, how did that affect the military veteran? It didn't affect the military veterans at all. The military have claimed over the participants' bodies not liable for malfunction. There's no malfunction with the COVID-19 vaccine. You haven't heard any other military that has returned home have any claims or make any ill claims of the Ebola mRNA vaccine. There's none. I've already researched it. Yep. So that kind of knocks that all out the window. What vaccine would they give the military that would have long-term effects to where it would destroy them in the future? You know what I'm saying? Like we really got to deal with all of the, we too many if, ands, and buts. Too many if, ands, and buts. Let's deal with evidence, facts, and results. Let's not speculate. We don't have to speculate about anything. We can get to the nitty gritty and deal with what we need to deal with scholastically because we are the ones that's gonna do the extra work. Now I know. I was just saying a lot of vets are out of shape and something bad happens to them all the time. Uh that's a personal choice of those vets. They're no longer, you know what I'm saying, as active as they were. They could have sustained injuries in the military that led to certain things, you know. Um, those things happen. Those things happen. We ain't dismissing those things. I'm just saying in general, like if you talk to vets and you talk to them about things that have happened to them, they're gonna tell you that have happened to you, you know. So that's how stuff be going. We just got to be the more honest ones. We got to be the more scientifically literal ones. We got to deal with the actual evidence. We don't need to speculate, play, or assume anything. They're working on an actual. They're working on an mRNA vaccine right now for pelvic cancer. Just to let y'all know, that's how it go. So yeah, man, I don't want to drag this out. We got like a couple of minutes, and then I'm gonna end the show. I'm gonna keep it at an hour. But if y'all ain't got nothing, nah, I don't see no dumbing down. I totally disagree. If we don't have evidence for it, we can't make a claim. We have to have substantial evidence to actually partake in, saying certain things about certain situations, circumstances, and things. Let me see. We good? All right. So it looked like I go back, I check all the messages. The Most High told us not to pursue after DNA. Crazy. Yeah, man. Look, if you see the show, if you see this, follow instructions. Hit the damn like button. Support us. Subscribe to the channel. Tune into Coffee and Cookies in a couple of hours. About an hour and a half. What time y'all going live, Sutet?
8 o'clock Eastern.
Okay. So it is 5:46 Eastern right now. So in a couple of hours, they're gonna deal with the deal. You know, as far as the bombing in Nashville, the people are still down there working on trying to resolve all of that. We know what the dude looked like. He is a pale skinned guy. Um, you know what I'm saying? Apparently he had some properties he was giving to this girl that he had a crush on or like or whatever. And so he started trying to give her things of that nature. She was wholeheartedly inherited. So he done made her probably rich because she ain't have no investment into none of that stuff. So if she sells, she gonna get the bank. And he gifted it all to her. So she sell whatever gifts he been giving her, and she sell those properties, she get bank. She gonna get paid straight up. You know what I'm saying? Not no 50 or 60. She might get about 100 or something, depending on how long he had them. But yeah, on that note, man, you know what I'm saying? I ain't gonna hold y'all up. We're gonna kick it like that and keep doing what we doing. Melvin said again, he kind of reiterated only in the cytoplasm and meets ribosomes, and ribosomes make protein, and the mRNA goes away. Period, point blank. That's how I go. And we got a good idea out of the videos that I showed y'all. Real quick, I'm gonna make another press run. Let me make another press run on this article real quick because I really didn't show it because of Facebook Live. I really didn't. People on Facebook Live, they really like that quick stuff. Like they can't get into the too long, the tech. You know what I mean? They can't be too technological. They ain't into that. It's got to be microwave. I don't know how to microwave it. I gotta learn how to microwave. But you know, this article right here, it's in the description. So, you know, you can deal with that. Recently, I've got an influx of questions about how we can really be sure the mRNA vaccines will not affect our DNA. In my prior post on the subject, I wrote, and then he goes into that right there. And then he shows, look, when it gets here, it's gone. When it meets the ribosomes to make the proteins, it's gone. You know what I'm saying? That's why I always use your skin. Look at your skin. Look at your, you know, look at that. That's your first line of defense. The skin is the first line of defense. Then your eyes, your nose, the mucus. You know what I'm saying? Some people might contract something via their mouth. They might touch something and then touch their mouth or their lips. But look, it says here, firstly, for mRNA to affect your DNA at a minimum, we need to establish that it would need to gain access to the DNA in question. There are two subcellular compartments where this can be accomplished. The first is the nucleus. So let's start with a discussion of the trafficking of cargo in the nucleus. The nucleus of cell is an isolated compartment with pore complexes, NPCs, that impose limits on the size of the particles that can freely enter. RNA is readily transported out of transcription occurs within the nucleus, but the ribosomes required to produce proteins are in the cytosol or on the rough endoplasmic reticulum. Now, this process is mediated by several accessory proteins, which you can see on the left, which we've seen in the image. Note, however, that there isn't any physiological circumstance in what one might need RNA from the cytosol to be transported back to the nucleus. RNA is synthesized within the nucleus. Viruses, which have a nuclear phase in their replication cycle, have to have various tricks to be able to allow their RNA payload to enter. Though RNA is not readily transported in the cell, proteins can be. This occurs via the network of proteins called M proteins. Proteins containing amino acid sequence called the nuclear localization sequence are able to bind in the M proteins, which could then transport them across the nuclear pore complex as shown on the left. RNA viruses often have replication cycles that do not require access to the nucleus, but there are some exceptions. Influenza viruses, for example, are RNA viruses that have their own genomes associated with ribonuclear proteins, and these ribonuclear proteins express nuclear localization signals that facilitate the entry of their genomic RNA into the nucleus. mRNA vaccines, on the other hand, are not associated with any proteins. Once inside the cytosol, the mRNA is naked and exposed to the harsh environment of ribosomes and exonucleases, which destroy the mRNA in a matter of hours at most. There is no conceivable mechanism by which mRNA can spontaneously be trafficked into the nucleus. Being made of nucleotides, it cannot contain a nuclear localization sequence. The other relevant compartment would be the mitochondrion. Mitochondria are actually vestigial bacteria with their own genomes, and it's thought that billions of years ago, an ancient bacteria tried to consume the ancestor of mitochondria, but lacked the machinery to actually do the digesting, and the two established a symbiotic relationship. Since the instance, mitochondria have been a central feature of the cell biologists. This allowed the mitochondria to develop an extremely reduced genome containing only 37 genes. Most of the genes relevant to mitochondrial function are still in the nucleus. Mitochondria have their own ribosomes and their even own genetic code, sort of. There's also a specialized process for the clearance of the disease, mitochondria, called mitophagy, which is the subject of many excellent reviews. This, and this. Now, the collective conclusion from our understanding of these biological processes is that a naked mRNA in the cytosol has no potential to end up in the cellular compartment that contains our own DNA, means that irrespective of the presence of absence or other factors, there is no chance of harm to the DNA from an mRNA vaccine. But still, people want to ask me about reverse transcriptases, so let's discuss those. I ain't discussing all that. I'm going to leave it right there, and I put the article in the description of the video. We play no games around here, and we get busy. We answer the questions, and we keep it moving. We might take the long way because we don't do shortcuts. We don't microwave over here. And this lecture right here on vaccines, this was a pretty good lecture again. You know what I'm saying? But, until we meet again, this video is an hour. It's bite-sized. It's bite-sized. So if you missed it, you can go back and you can review it. And, it'll do all of the do. It will do all of the do. On that note, Black African Power. Alright, ladies and gentlemen, the books is in. The books are in. Yep. They're in. Here.